Discussions around recurrent and residual disease then bring up more complex discussions around death and dying, and there are quite different and complex beliefs for my Aboriginal and Torres Strait Islander patients around that. Sometimes I need to have a dialogue directly with my patient, but and other times that's too difficult for them to do directly, so I'll choose to find a time with a patient relative, either on the phone or sometimes directly after clinic, to discuss what's important and have two-way learning about what is culturally relevant for my patient, particularly towards the terminal stages of life. I find that sometimes my patients don't want me to be involved in their care anymore, and I do find that difficult. But then the next thing for me to do is, well, what's important in this patient's next steps for their management plan, and passing that on to whoever's going to be coordinating that down the track. I think fighting for my patients to make sure that the logistics are in place for appropriate death and dying is important.
When we're dealing with the death or the dying process of an Aboriginal or Torres Strait Islander person, I find a lot of them want to go back home to country before they get to that dying process. A lot of them, it's really important to touch the soil. They're then pretty happy to come back, and then others actually want to go home to country to die on their own land. So we've got to be able to provide exceptional care in the patient's own home. That requires a lot of rapport building and a lot of honesty and integrity in what we're saying and what we can deliver, and a lot of trust from the Aboriginal or Torres Strait Islander person and their family, so that we can provide a very comfortable, non-frightening death experience for them at home.
There's a common myth out there that this is, it's the end of the road, this is the death house, I guess. And the truth is that people come to us, and what happens here is we're here to manage their pain. That's what palliative care is. Spiritually, we have to look after them while they're here, as well as their health is very important. And it's all about patient-centred care for our people here. And quite often we'll ask people to bring in different things if they're coming from remote. Bring in little knick-knacks from home, like maybe a piece of rock or whatever, to put it in the rooms with them so that they feel quite at home. So what we talk to our Aboriginal and Torres Strait Islander people is, we talk in terms of, when this medicine can't fix you anymore, it can't fix your sickness anymore, then that's when you come in here and we just manage your pain so that you don't feel so much pain. You can have a better time left with the family that you have here. And then when you're feeling strong enough, then we get you home back on country, if that's what your wishes are.